following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Our topic tonight, allergies and sinusitis. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. Every year we hear people say that this allergy season is the worst ever. But for many people, allergies isn't just a seasonal occurrence. Millions of Americans suffer from allergies to dust mites, mold, animals, as well as various foods and drugs. A related issue is sinusitis. There's an increasing body of evidence that allergies can touch off sinus infections in some people. What can you do to prevent allergies and sinusitis? What treatments are available? We'll get answers to those questions and more tonight from our two guests, Dr. Hassan Ramadan, an otolaryngologist at West Virginia University Hospitals, and Dr. Michael Hurst, also an otolaryngologist at West Virginia University Hospitals. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Hassan, we'll start with you. Is it true that more people suffer from allergies and sinusitis than in the past?
Yeah, that's a very good question. Recent scientific evidence does suggest that in the last several years, almost in the last decade, that allergies have been on the rise. I don't know that we have an explanation. Several reasons may be. Some of them are like the environment, pollution. Our kids maybe are like not exposed to a lot of viral infections when they're younger. Makes their immune system a little bit weaker. They pick up allergies later. But it is definitely true. All the scientific evidence points to that.
Very interesting. Mike, what exactly is an allergy?
Well, allergies, John, are basically a misdirected or misguided immune system. The immune system is a very important part of keeping us healthy, helping us fight viruses, bacteria, tumors even. But in people with allergies, that immune system begins to react to things that shouldn't really be harmful.
Interesting. And now people who have allergies are more likely to have sinusitis. Why don't you start by telling us what sinusitis is?
Absolutely, John. I think this is definitely the case. Now, sinusitis is basically mainly a bacterial infection of your sinuses that are in your face. The majority of the time these occur in the winter season because viral infections, or what we call colds, are the number one cause of sinus infections. Now, what's number two, you'd ask me? Number two is allergies. So allergies are the second most common cause of sinus infections. The reason, briefly, is both the cold and the allergies cause swelling in your nose, secondarily swelling in your sinuses, blockage of the sinuses, and this is how an infection starts.
Yeah, once those sinus passages are swollen and blocked, then the mucus that's normally made in the sinus and nose all the time is trapped, and then bacteria begin to live in that trapped broth that serves as a good place for them to live.
Well, we'll certainly get back to treatment and symptoms. We already have our first caller. It's Karen from Raleigh County. Karen, welcome to Doctors on Call. You have a question for our experts.
Yes, thank you.
Go ahead.
My daughter is 5.5 months pregnant, and she can't take her regular medicine, her regular shot. And I was wondering, what can she take that won't hurt her baby, that would have bad allergy?
Good question.
That's an interesting problem because In pregnancy, women tend to have a stuffier nose anyway. And I generally, if people are on allergy shots, if she was taking shots, and you said something that made me think she maybe was, I don't have people stop them. We don't test or start shots during pregnancy, but if you're on shots when you get pregnant, you can continue those shots, assuming there haven't been any problems before the pregnancy. The drugs available in pregnancy to treat allergies are rather limited. There is one particular nasal steroid spray called budesonide that's approved for use in pregnancy, and the rest of the nose sprays are not really approved for use in pregnancy. I think it's best to talk to the gynecologist or the obstetrician that's taking care of your daughter. They generally have a certain list of drugs that they think are appropriate for people in the second trimester to take.
Very interesting. So let's get back to allergies and sinusitis. What are some of the symptoms? We were talking about sinusitis. What are some of the symptoms that a person would have with that infection?
Those can vary very much, John. So you have those individuals who may have what we call an acute infection, which is like an infection that they catch every now and then. So those symptoms will vary from people who have what we call chronic sinusitis. Those are individuals who would have almost a year-round or long-lasting problems with their sinuses. We put them in the chronic category. In an acute situation, you may have significant pain in the face, your teeth may hurt, you may have colored nasal drainage and discharge. In the chronic cases, all you may have is just like a pressure in your face or a postnasal drip. You may not have the colored drainage, you may not have the pain in the teeth or in the cheeks. And in kids, for instance, the only symptom sometimes may be just cough, or maybe their asthma will get worse. So that should trigger an investigation in some of these individuals to look whether they have a sinus infection.
Well, there's a lot of crossover between allergy symptoms and sinus symptoms, but Hassan brought up asthma too. How is that related?
Well, asthma and allergies are basically just variations of the same disease. In the allergic patient, the target is the nose and the sinus passages, and in the asthmatic, the target is the lungs. And it all goes back to inflammation. Hassan mentioned swelling, and it's inflammation that causes the swelling, and swelling in the nose leads to trapped mucus and sinus infections. Swelling in the airways of the lung lead to cough and wheeze and shortness of breath.
Okay. So when does a cold or allergies become sinusitis? When should a person go to see their doctor, say this is more than just a typical cold and allergies?
So this is something that's difficult, and then at the end, it boils down to when the patient is sitting with his doctor in the office. He needs to evaluate the symptoms. He needs to do a good exam and determine at that point that is this still a cold or is this a sinus infection now. We do have some studies in the literature and some guidelines which suggest, like, if you have a cold and that cold by day 10 is not getting better, so it doesn't need to be gone or you're completely relieved from the cold symptoms, no. But if it's not getting any better by day 10, you really should suspect that you may be getting a sinus infection on top. Remember, we mentioned that colds are the #1 cause of getting sinus infections, and this is usually what happens. You have a cold, it doesn't go away, and then it may end up with a sinus infection. So those really are the guidelines. It's time, the symptoms that you have, how you're turning around, and your doctor will have to make that determination in the office.
Okay. And then what kind of studies may be done to make the diagnosis?
Well, probably the most important two things are the history that Hassan mentioned and the physical examination, what the doctor sees when he examines the patient, looks in the nose. Sometimes x-rays can be helpful. And really the mainstay, and one of the things that ear, nose, and throat doctors do routinely is to put scopes in the nose. We can spray medicine to make it numb and then put a light, a little telescope that we can look through to see what's coming out of the sinuses, see what kind of swelling we can find.
Interesting. We have our next caller. It's Doug from Harrison County. Doug, welcome to Doctors on Call. What's your question?
Well, my question is that I have been a patient both of Dr. Hurst and Dr. Ramadan. I've had endoscopic sinus surgery done at Johns Hopkins and twice by Dr. Ramadan. Now, my question is, there is something new out there to relieve the blockage in the frontal sinuses, either balloon sinuplasty or sinus stents, and I'd like for them to comment on that and let me know if that's being done now by these doctors.
Great.
Well, hello, Mike. It's good to hear from you again, I guess. But you're on top of it, I would say, because those balloons are really very recent. It is cutting-edge technology that is still being rolled into the market. And then see, Mike, I guess he's a chronic sinus sufferer, so he's looking for anything to help himself, just like millions of people are like that. But what he said is true. There are now some tools that we can use as otolaryngologists whereby we can go with a balloon. It is very similar. As a matter of fact, they got the idea from balloon angioplasty for the heart. So instead of having an open heart, cut the stenosed vessel and then reanastomose, you can go in with the balloon and dilate that vessel. So it's the same principle. So you put a balloon, and then we said, Mike mentioned that too, that's the blockage up there in the sinus that's giving you the infection. So how are we going to relieve that blockage? So balloon is one of the tools where you can put that balloon up in that obstructed area, blow the balloon up, then you remove the balloon out, and then you hope that that hole will stay open. Quickly, he mentioned something about stents. So sometimes when you pull the balloon, if you feel as if the blockage is going to re-swell back up or it's going to close, you can put a stent up there, and then it will release certain medications that will allow that to stay open.
Very good. Well, certainly that would be a last, maybe not ditch effort, but later on in the therapy. What are some of the things you can do routinely initially to treat sinusitis and allergies?
There are three basic, for sinusitis, acute sinusitis typically responds well to oral antibiotics. Now, it's not uncommon to have to treat that for 20 days as opposed to 10, but usually acute sinusitis will clear with appropriate antibiotic treatment. Chronic sinusitis is a much different animal, and Doug touched on some of the frustration in that in spite of surgery, many patients will continue to fight chronic sinusitis. To treat allergies, there are three main ways of doing that. One's with medicines. Antihistamines are both available orally and topically in the nose. Steroids, and the main form of that is topical nasal steroids. And then there are a couple of other drugs, other anti-inflammatory drugs that antagonize certain inflammatory mediators. You can also avoid what you're allergic to, which is not often practical for a lot of patients. And then thirdly, if the medicines and the avoidance don't work, allergy shots are a useful way to treat allergic symptoms.
Very good. We have our next caller. It's Judy from Fayette County. Judy, welcome to Doctors on Call. Do you have a question?
Yes. Do you tell me if sinus problems can lead to abscessed teeth?
Good question.
Mike was a dentist in the past, so he would be able to address that.
It's actually much more common to go the other direction. Teeth can infect sinuses. Sinuses rarely cause tooth problems.
Interesting.
I agree.
Okay.
Yeah.
So, but the symptoms may be similar? Is that why?
Oh, yeah, absolutely. It's hard. It can be hard to differentiate a tooth problem from a sinus problem.
Okay.
And frequently you have to see a medical doctor and a dentist to try to sort that situation out.
Well, Doug brought us to some of the newer invasive procedures that you have, but What other things can you do as an otolaryngologist to help out with sinusitis?
I would rather, John, you mean like if medical treatment failed,
right,
like what can we offer the patients? So one that was raised up is the balloons, because studies are still ongoing regarding that. So we're still not clear exactly who will benefit from a balloon versus other types of surgery. And other types, the most common type that we use in this day and age now is endoscopic sinus surgery. Mike talked about using the scope to diagnose the sinus infection, so you can use the same telescope with the better lighting and the better equipment and the micro instruments to go in and open the blockage of that sinus. I mean, we established that blockage is the problem, so if you get rid of that blockage, the sinus should be happy, it should drain, breathe, and you shouldn't have too much problems. So the introduction of balloons here recently is to make that even more simpler, which is like instead of going in and removing bone or tissue to open that sinus, then you can go ahead and use a balloon to dilate that sinus and open that hole without needing to remove any tissue or removing any bone.
Is that an outpatient procedure? Do you do that in the office or is it in the operating room?
At the present time, this is something that we'd have to put the patients to sleep. Now, there is talk that down the road, like you dilate that sinus and it closes back up, you don't need to keep putting these patients to sleep. So maybe at some point in the future, when the technology is more advanced, you can probably do that in the office, but not at this present time.
Okay, very good.
Before I forget, John, something else that helps a lot of people with chronic sinus problems and allergies is just simple saline nasal sprays. Neti pots that you put salt solutions in can also provide a lot of relief to people with chronic problems.
Sure, as long as you keep the drainage
right. Try to wash it out.
Absolutely.
Very good. Well, Phyllis from Monongalia County is our next caller. Phyllis, welcome to Doctors on Call.
Thank you.
Do you have a question?
Yes, I do. I am wondering what makes your nose run when you're eating. It just seems like once you start eating, the nose starts running and you're wiping more than you're eating. Is there anything that you can do about that?
Is there a particular food, Phyllis, that you have noticed that symptom with, or
No.
just anything?
Just everything.
Okay.
Yeah, there's a neurologic, a physiologic explanation for that situation. The same part of the nervous system that controls salivation also controls those glands in your nose that produce mucus. So especially as we get older, we find that meals will not only stimulate saliva, but it'll also make your nose run. And there is one specific nose spray that has some utility in treating that problem. Its brand name, this is not an endorsement, but its brand name is Atrovent, and it will help as much as 2/3 of the people that have that kind of nasal discharge.
Very interesting. So that's just a daily spray that you take for prophylaxis?
Yeah.
Yeah, there's basically an imbalance, you know, and for some reason we do get this imbalance as we get older, just like with everything else, you know, lose hearing, lose sight. So it seems as if there's imbalance, and then for some reason our nose and then our taste buds do not like distinguish much. So when you're eating, it's as if you're hungry, your nose would run at the same time too. And then the medicine that works the best is, I agree with Mike, is Atrovent. Again, we're not endorsing it, but that's the only form that it comes in at the present time.
Great. Well, Phyllis, good luck with that. I hope that was helpful for you. Our next caller is Pam from Barber County. Pam, welcome to Doctors on Call.
Yes, hi, how are you?
I'm fine. How are you?
I'm all right. I'm calling about my husband. Here, it's been 2 weeks now, and the doctor's telling him this is allergies. He woke up dizzy. He was in a cold sweat, and he felt sick to his stomach, and this was like 4:30 that morning. Is this some type of allergies or what?
Is that, is it a real spinning around kind of dizziness like he's on a merry-go-round?
Yes.
There are other more likely things to explain that kind of symptom, especially occurring early in the morning. Did he get out of bed, hop up out of bed and found that he was spinning around?
Yes, he did.
Yeah, that sounds more like an inner ear problem. And you may have to have him seen at an ear, nose, and throat office to do a simple little test that's done in the office to see if he has a specific kind of inner ear derangement. And it's simple to treat if that's what he has. I don't think that strikes me much like an allergic condition, truthfully.
It's been going on now for 2 weeks.
Yeah, and he turns his head and it gets worse, and if he lays in certain positions or still, it's better?
Yes, yes.
Yeah.
Great. Well, good luck, Pam, to you and your husband. Well, you brought up your specialist in ENT. With sinusitis, certainly you don't see everybody with sinusitis. When should a patient think about seeing you as a specialist after their primary doctor has tried to treat sinusitis?
I don't know that there are any hard and fast rules. I would think if somebody has been on treatment with nasal sprays and antibiotics for 3 weeks, and they still have symptoms, it's time to see a specialist. As Doug pointed out early in the program, we can't cure everybody with sinus problems, but we can offer help for most. And it's something that you should talk to your family doctor about and see if it's time to get a referral.
Excellent. Our next caller is Walt from Frostburg, Maryland. Walt, welcome to Doctors on Call.
Thank you.
Do you have a question for our experts? Walt? Okay, well, I think we lost Walt, so we'll try to get him back on the line. Okay, so very good. Anything else in particular about the sort of special interventions that you can offer that you may want to bring up?
To follow up on your previous question, if I may, 90%, if not more, of sinusitis is really treated at the primary care end. The majority of sinus infections is in people who get them here and there every now and then, and their primary care doc really takes care of them. So only the small percentage of those individuals who, despite all what their primary care doctors do, keep getting a sinus infection, or maybe after several attempts with antibiotics and other medications that they don't get any better, those are the ones that probably will benefit from seeing an otolaryngologist. Okay. Now, as far as treatment, medical treatment is the mainstay treatment of really sinusitis. Again, just like 90% of them really get better just by medical management. Mm-hmm. So only few will need our expertise and maybe eventually surgery.
Okay, very good. Is there anything that we can do to prevent? Certainly, we can avoid allergens. Is there anything you could do to prevent sinusitis?
Hassan mentioned earlier that most sinus infections begin with a cold. So just the standard wash your hands, stay away from sick people, don't cough on other folks when you're ill. That's the only preventive thing I know about. Just
stay at home if you're sick, don't come and spread it, etc.
I think I know the answer to this question, but I'll bring it up. Smoking?
There's definitely evidence here recently to suggest that smoking will increase the likelihood of you getting sinus infections. And then the reason behind that is the cigarette smoke, affects how your nose cleans itself. It makes it slower. So things sit still, stagnate. Mike mentioned earlier that you'll have that and it sits in there and it's a broth or a breeder for the bacteria to grow.
Okay. Well, we only have a minute to go, and we have Walt from Frostburg back on the line. Walt, can you ask you a question quickly?
Yes, I've had polyps removed a couple of times, and I was wondering if I could expect more of that.
Yeah, that's one of the hallmarks, Walt, of nasal polyps is they recur. So most people that have one polyp operation end up with a couple or three. and nasal steroid sprays, and maybe some of the newer nasal antihistamine sprays are the thing to use. A lot of saline irrigations and
if you have not been tested for allergies, you need to be tested for allergies, because allergies are a very big contributor in the formation of polyps.
Excellent, excellent. Well, good luck to all of our callers, and thanks for calling. We've been talking about allergies and sinusitis with Dr. Hassan Ramadan and Dr. Michael Hurst. Thank you both for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Join us next week for another Doctors on Call. Our topic will be women's health.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.